Hello, everybody. My name's Ed Pavlik, and I'm in Lexington, Kentucky, where the roads are pretty good, but I really did not really feel comfortable driving to Owensboro today. I want you to know that I want to talk to you about ovarian cancer and ovarian cancer screening, and I will go through this rather quickly. So please bear with me if it takes too long or if I don't do a good job. So ovarian cancer starts in the ovary for the most part as a small measurable lesion, which we can detect by ultrasound in our screening program. And as it gets bigger, we can certainly still detect it. But then when it gets very big and it's detectable, it becomes have a potential for spread. It can spread to the lungs, diaphragm, omentum, and it can basically go anywhere in the body. So what do we know about ovarian cancer? Well, there's several types. The one that is the most common is also the most dangerous, which is high-grade serous carcinoma. Nevertheless, all of these have a mortality associated with them. When we compare the mortality, in other words, the ratio between death and incidence, ovarian cancer is much more deadly than breast, endometrium, or cervical cancer. The incidence of ovarian cancer increases with age, so people over 50 really are climbing the curve where the chances of having an ovarian cancer diagnosis are really quite high. Now, if we compare late-stage diagnosis to other cancers, cancer of the ovary really has the highest probability of being detected late. And that's the explanation for why we want to detect it early, so that we can really administer treatments that are curative, and that's why we want to screen. Survival falls off with stage, so we really want to be in the early stage where survival is high, and certainly in stage 1 and 1A, surgery alone is curative. Our team, is fairly large. We have seven ultrasound techs that work with us. We have an office for scheduling, and then we have gynecologic oncologists who are there to verify the findings. The screening process can be, understood in this cartoon. Basically, a person comes in, she gets screened. If she's normal, she'll return in a year. All screening is free and without charge, and this is for the first time and any subsequent times. Now, if there's an abnormality, we can do one of two things. We can route her for physical exam to one of our GYN oncologists, who either recommend that she comes back at some interval for a repeat screen. And if it's going to disappear, then we can avoid surgery. However, if it doesn't disappear, then surgery becomes the option that we are pursuing. Now, the screening machine is an ultrasound device like this with a transvaginal probe, and any abnormality that we see on that may well cause us to recommend a biomarker test, so that confirming something requires sort of a two-step process. One is the biomarker, which we give after having an abnormal ultrasound exam. Size of our program has participants in every county in the state, and the number of participants that we do have are almost 52,000 at the moment. We've given almost 400,000 free screens. We've detected 764 tumors, and 127 of these have been early stage disease. The 5-year survival for people in our screening program is greater than 86%, but when compared to the unscreened population at our hospital, it's under 45%. This shows you really the fall off of survival if you're not being screened, and the benefit of survival if you are being screened. What does ultrasound see? Normal ovaries look like this in this slide. Basically, the ovary is right here or here or here. And abnormalities then look like these type of images, none of which are malignancies. But when we follow these long enough, they will disappear. And what we're looking for are things that don't disappear and look abnormal, and that's what I'm showing you here in this slide. Our approach is called serial ultrasound screening, which means after we see something, we want to see it again to see if it's disappearing. If it is disappearing, we know that we don't have to do surgery. So there are different time courses to follow. Some disappear quickly, others not. The whole serial ultrasound screening approach reduces the need for surgery by 2/3, while it increases the number of surveillances by 3-fold. Now, what causes cancer? Well, the first possibility is that no one knows. The second possibility is the idea of the overworked ovary. A laying hen basically has an overworked ovary and has a much more chance of having an ovarian cancer than the hen that's running around the barnyard with the rooster chasing him. So that's one possibility. Long ovulations, which nuns have, they have no interruptions to their ovulation cycle, and so that overwork type of process occurs there, and they have a higher incidence of ovarian cancer, nuns do. There's a protective effect by interrupting ovulation due to having multiple children, or taking things like birth control pills. So we know that there's something to do with the ovary, probably ovulating too many times, probably having a missed healing for that type of event, and so it results in ovarian cancer. Now, what can we do? Well, the basic risk-reducing strategy is to remove the ovaries and take the fallopian tubes also, and that reduces risk. That's the major thing, to do. It tends to be the safest, because we want to do this really at a time where we don't introduce in an early age menopause, if that's possible. So that's the information I wanted to share with you today. I hope it means something to you. Please know that you can contact me either by calling University of Kentucky, asking for the ovarian screening program, and they will find me on the phone, and I can talk to you and answer any of your questions. You can email me at epaul1@uky.edu. Now, my last part of my message really means I'd like to, rather than invite you to travel all the way to Lexington, is to contact me with people who would help us establish screening at one of your medical centers, hospitals, or clinics. We're doing this elsewhere in the state as a partnership, where we pay for the expense of screening by a sonographer there on site. And it basically creates a very efficient process for us, where we don't get any loss of screening time due to travel time. So if you'll help me that way, I'd appreciate it. Once again, you can call me or you can email me. And if you need to, I'm glad to talk to you after hours. Just email me for my cell phone number. Okay, I appreciate being with you today. And I hope that we can push forward with having screening in Owensboro.